Here are 5 easy tips to follow if you're starting incretins, either Ozempic, Wegovy, Mounjaro, or Saxenda. The first tip is start always at the lowest dose possible. This is key for you to be able to tolerate higher doses where we see most of the weight loss. So I know many patients want to start quick and they want to start losing fast and they want to start seeing high numbers of weight loss. But if you don't tolerate the first dose, you're not going to tolerate higher doses where we see most of the weight loss. Second tip, only move to that next high dose if you're tolerating the current dose. If you're not tolerating the current dose that you're on, you're not going to tolerate higher doses, right? Or it's going to be very difficult and you may want to stop treatment, right? So only move up when you are tolerating your current dose. Third tip, do proactive or conscious hydration. So these medications cause a lot of dehydration, severe dehydration in many, and your thirst effect is not going to kick in even if you're dry as a bone. So you have to do conscious hydration and keep track of how much you're drinking. Dehydration is, I think, is the hardest side effect on most patients because it can give you extreme fatigue. You feel run down, dizzy, lightheaded, and it's not that you haven't eaten, it's not a low sugar, is dehydration. So we can prevent that by being proactive and keeping track of how much you're drinking, about 2 liters of water per day with electrolytes. Fourth tip is listen to your gut. When you feel full on these drugs, you stop. If you overeat your fullness, you're going to feel more nauseated, painfully full, and you can even vomit, right? So as soon as you feel that fullness effect, even if it's 1/3 of what you normally would eat, half of what you would normally would eat, you stop. Okay. And the fifth tip is to be patient. You need a lot of patience when starting this treatment. Think about it. You struggle with your weight for years, sometimes or some decades. So we are finally here. We finally have something that we can offer you that is actually going to resolve and help with weight loss and that we can use for long-term maintenance. So you don't have to maintain the weight loss on your own. We have it. We finally have something that we can offer you that is actually going to work. So all we ask is that you're a little bit patient, and especially when starting the treatment.